Mohs surgery is the most effective surgery to treat skin cancer, such as BCC, basal cell carcinoma, and SCC, squamous cell carcinoma. Mohs surgery has a very high success rate with a 97 to 99% cure rate. The technique to Mohs surgery is to remove cancer in increments to preserve healthy tissue. First, Dr. Abreu will mark and numb the affected area with local anesthesia. The tumor is then excised by an instrument and examined under a microscope to see if all cancer cells have been removed, while the area is bandaged and the patient is directed to the waiting room for results. If cancer cells extend beyond the first stage, the process is repeated until there is no more cancer. The process of Mohs surgery can take several hours. Once the cancer is all out, Dr. Abreu will repair the wound using sutures with a conventional approach, or sometime Dr. Abreu will borrow skin from the adjacent areas using procedures like flaps or grafts. In some cases, the wound may be too large to be repaired. Dr. Abreu will then refer the patient to a plastic surgeon, ENT or ocular plastic surgeon. Our practice will continue to monitor the healing process and the progress of the cosmetic outcome of the area treated. Mohs surgery is a highly effective way to remove skin cancer while sparing as much healthy tissue as possible, thereby minimizing scar and achieving a high cure rate.